All right, we're fine. We are recording and live streaming on Facebook as of now, just FYI. So, and
Well,
it's 12.
welcome everyone. My name is Tracy Gibson. I am with Home Instead, and I am brought to you today because I am on the executive committee with the Chamber, and business advocacy is the area that I try to help with. And in today's world with COVID, we thought that this was the ideal opportunity to bring the people in our community together that is actually living through COVID. They're touching it. It's not something that is just what someone else says. This is our community, and we want to learn from them. The people that will be speaking today is Dr. Joseph Mazzola, who's a board certified family physician who has worked as a physician executive for several health systems. He presently serves as the Vice President of Medical Affairs at Iredell Health System. Dr. Walter Metters graduated from UNC Chapel Hill School of Medicine and is also serving as Piedmont Healthcare's Medical Director. Dr. Franklin is also going to be with us today, is an emergency medicine doctor at Davis Regional Medical Center. And we will have Megan Redford, Director of Public Information with Iredell County Health Department. And I am now going to turn it over to Dr. Joseph Mazzola to share with us COVID.
All right, well, thank you. If I can get a thumbs up that you can see my screen.
Yes,
All right,
sir.
perfect. Well, thank you, and thank you for letting me be part of this. I did talk to the folks as we were getting ready. I may have to drop off slightly early. As you can imagine, these are really busy times. What I'd like to do is kind of just kick us off and give us a little historical perspective about COVID, and then bring us up to date as to where we are at our health system with our COVID care, our COVID management. So if these will start, if my slide will advance, there we go. So we're going to look back really quick. It's hard to believe 20 months ago or so, we were hearing about a novel virus that was identified in China as a source of maybe an outbreak of some pneumonia. If we go back in time, you look at in December of 2019, basically China had some cases, less than 100 cases reported. Then we started to see reports coming out in this country. The JAMA article came out. Dr. Fauci is one of the authors. January 2020, that it may just be more than this common cold. And again, I'm just kind of framing a historical perspective for us. I think this is an interesting walkthrough as you look at how this virus spread. So this is January 2020. You see that China was involved. Obviously, as the colors get deeper, red, burgundy, burnt orange, these are higher number of cases. So we're going to just walk through several months and then really put this into perspective as to where we are today. So February, we started to see spread, start to see it in North America. Obviously, by March, we all lived this. The numbers continue to rise. April, things got darker, more of the world involved. May of last year, you have 2020. The world continued to get deeper. We had no major restrictions. We remember lockdowns. People were not working. This is August of last year. You could see how deep we were in the United States, and how you can see, the USSR and China is still deep. This is August of 2021. So essentially, this is a pandemic that has reached, just astronomically high penetration of cases. So when we think about coronavirus, because we have to remember that this COVID-19 virus is a SARS coronavirus. We know and have known that coronaviruses have pandemic potential. We know that good public health measures are critical to controlling any pandemic or epidemic. We know the problem that we've seen with this virus is some people get a very mild presentation, some people are asymptomatic, and so it doesn't necessarily send the message like an Ebola. When those of us who lived through the Ebola scare, that if you were to contract Ebola, you had a very high likelihood of morbidity or mortality of dying from it. Obviously, when you see the world globally working together is important. And then we do have some experience with this coronavirus, and I think others on the call are going to talk a little bit about vaccinations. So current situation, I thought it'd be interesting to give you where we are currently, from the perspective of Iredell Health. And obviously we collaborate with our health department, we collaborate with Piedmont Health, we collaborate with Lake Norman Davis, our other community hospitals. So when you think about the curve of this trajectory, the epidemic curve, this is data from August, so currently living through this. You can see where their cases are either low, moderate intensity and decreasing. Those are in the blue. In that sort of yellow color, low, moderate, but increasing. So certainly just north of us is an increasing area. Substantial incident, but decreasing, sort of that light tan color. And then the burnt orange, the dark color, is substantial penetration and increasing. And you see the United States is just leading the world in substantial number of cases, and we're still increasing. I do want to set up a little bit for the speakers that are going to follow me when we think about this vaccine that we have available. Again, published in January 2020, there was a novel vaccination that was being developed, an mRNA vaccine, and the first report came out with 45 people were in that initial trial. Then you take it, fast forward to August 2021. This is August 27th. 437,000 doses of this vaccine have been delivered in the United States. 366 million doses. So 437 million doses, 366 million doses have been administered to about 172 million people. So hopefully when my fellow speakers talk about vaccine hesitancy, we are actively living in probably the largest clinical trial ever for any kind of medication or vaccine. 172 million people have been successfully vaccinated with 2 doses or fully vaccinated with the J&J 1 dose. So this kind of gives you an idea of the vaccinations in the United States, where the penetration is. You see the Northeast, the West Coast have much higher penetration. Texas, those of us who've been in medicine a while, for some reason, Texas doesn't like to report data. So you see that they're grayed out, dithered out. We don't have good data on Texas vaccine administration rate. But, when you look at North Carolina and South Carolina and Georgia, we are lagging behind in our vaccine acceptance and our administration rate in our area. So those of you who like numbers, I look at this website every day. This is the NCD-HHS website, North Carolina Department of Health and Human Services. This was the data as of the 27th. It gets updated every Monday through Friday. You'll notice in North Carolina, the percentage of adults that are fully vaccinated, these are 18 or over, is about 60%. The scary number on this one that gives me pause is the newly reported cases of over 8,000 in our state. Just a few weeks ago, that was hovering in the 1,000 to 2,000 new cases reported. And the currently hospitalized at 3,651, again, just a few weeks back, that was, maybe 800 to 1,000. And in the peak of this pandemic back in January, February of last year, we were really just north of 4,000 hospitalized patients. And we haven't peaked yet, folks. This trajectory continues to rise. So when we look at new admissions in North Carolina, this will show you the peak in January and February. We saw that spike. It dropped off very nicely in March, April, May. We went into the summer, and the number of admissions to the hospital was going in the right direction. And I'll show you Iredell data here in just a moment. But you see the tail end of that curve is starting to go back up. And of course, we haven't seen the projection out into September. This is Iredell. So this is actual data for our hospital. We track this every day. We look at the number of patients that are in the hospital. The blue bar is the number of hospitalized patients currently in Iredell Health System. We have 55 today. When I put this slide together, we had 52. We track the number of patients in the intensive care unit. It was 11 when I put this together. This morning, it is 13 COVID positive patients in our intensive care unit. And the unfortunate statistic that I learned this morning as I've been here through the weekend is 13 of those 13 are on mechanical ventilation. This gives you sort of our trajectory of how our admissions have tracked through this pandemic from March of 2020 through August. Of course, August is not complete. But you'll notice the over 5-fold increase from July to August. We were 26 admissions last month, and we have 126. I'm sure that'll top out north of 150 by the end of this month. And then who knows what September is going to bring. The average daily census, again, the number of patients in our hospital, and this is just taking all days and doing an average. I didn't do a mean, median, mode. I just took an average. You could see in our peak period in December, January of 2021, our average number of patients in the hospital is 55. And right now in August, 37 patients is our average. But as I said, I have 55 patients in the hospital today. So looking forward, I don't mean to be the doom and gloom guy, so I want to give you a glimmer of hope, and I'm sure my colleagues who are going to speak as well will give us some great insight. We're dealing with this COVID-19 variant. We're dealing with the Delta variant. There are other variants out there that we are not necessarily tracking deeply in the United States. We are seeing through the North Carolina Department of Health and Human Services, the large majority of the COVID infections are the Delta variant. We don't specifically test for it here at Iredell, but we do know that any positive patient that comes into our hospital, they potentially could have the Delta variant. If you look at the state health statistics and the data that they do track the penetration, the large majority of the cases are now this Delta variant. And we're seeing this as a very severe variant. It is causing significant lung injury. The patients are not recovering as quick as we had seen with the prior spike in cases. So a little hope. We've been through pandemics before. We've been through pandemics with viruses. So as I've talked to other audiences and groups about this, in 1918, we had the Spanish flu. We got through it. We didn't have the technology that we have today with the ability to social distance, the ability to wear a mask, and the ability to be vaccinated. In 1957, 1958, we had the Asian flu. In 1968, we had the Hong Kong flu. We had the swine flu in 2009. We made it through those pandemics. We'll make it through this pandemic. We are in a much better place, medically, technologically, with the advances. It really is going to be a collaboration of all of us working together to message the same way. I plead with people, wear a mask, wash your hands, get vaccinated. In my hospital today, I am very comfortable reporting 93% of the patients in our hospital are not vaccinated for the COVID-19 virus. 93% are not vaccinated. It means only 7% of the people in my hospital today are fully vaccinated against this virus. And we are seeing, although anecdotal, the patients who are vaccinated have a much milder course of disease, are less likely to end up in the intensive care unit, and are more likely to be discharged home with a shorter length of stay. So hopefully I didn't use up all of my 15 minutes, so my other colleagues have some time. I'm going to stick around as long as I can. Excited to hear my other colleagues speak. And with that, I'm going to stop my share and hand it back.
All right. Thank you very much, Dr. Mazzola. And next to speak to us today will be Dr. Metters with Piedmont Healthcare.
I guess I better unmute myself if we're going to do that. Well, thanks so much, Joe, for that great overview of what's gone on. Most of my discussion is actually just going to be talking about vaccine hesitancy. Unfortunately, we've all been exposed to situations where we've been justifiably being unsure about what we are getting into. And it seems like this vaccine has engendered a lot of that. Certainly with the situation that we find ourselves in as a nation, being divided, informed by social media, no wonder we have some issues with worrying about whether or not this vaccine is something we should partake in. We're awash of data and opinions, but there are valid sources out there and we can get to them. When we look at, talking about Iredell County specifically, there's only 39% of our total population vaccinated in Iredell County. That's a sobering statistic. As we go up through the age groups, greater than or equal to 12 is 45%, 18 and above is 48%, and our most vulnerable population over 65 is 75%. We're neither the worst nor the best in North Carolina, Our sister county in Rowan is much worse than us. Their total population that's vaccinated is only 33%. However, in Mecklenburg County, it's 48%. So what we're seeing is that vaccination is a very essential tool in being able to combat the disease as it kind of courses through our nation. But then why not just wait for the disease to just take its natural course like it did with all the other pandemics? We didn't have a vaccination for that either. Well, unfortunately, there'll be a cost associated with that. As we're seeing now with people in our hospitals, there'll be people ending up hospitalized in the ICU, dying, having long-term complications as a result of their either treatment or disease. And there's something we can do about that, and that is vaccination. As Joe mentioned, that 93% of those patients in the hospital are unvaccinated. So our vaccinated patients actually have a much better chance of dealing with this disease. And going forward, that's what we have as a country. The more that are vaccinated, the more that have natural immunity, we're going to be able to tolerate this disease better as it morphs into as our immune system gets ready to deal with it. Eventually, it will be able to deal with the virus a little bit better than it does now, because it won't be novel. It won't be the first time we've seen it. We will actually be able to deal with it. Eventually, we'll get milder and milder, but it may take months to years for that to happen. So as of now, the best things we have in our toolkit are vaccination, masking, social distancing, and keeping our hands clean. We all saw what happened early in 2020 when the New York and New Jersey systems got overwhelmed, the morgues got overwhelmed. We're starting to see that in some of our states today, unfortunately, due to the Delta virus. So that Delta variant was a game changer. We were trending pretty well this summer. We were feeling pretty good about ourselves. Vaccination rates were kind of stable, but the virus wasn't causing a lot of disease. But then when the Delta virus came on board, it changed everything. We have to realize that is definitely causing more and more disease now. And roughly over 95% of the COVID infections in the nation are due to the Delta variant. And that's where we find ourselves now. So why do some people not get vaccinated? That's sort of what I wanted to address, is that, there are some issues there. I think the biggest one I do see is complacency. It really doesn't affect me. I haven't had a family member. I haven't gotten sick. I don't really see it as a problem, or I don't believe it's a problem, or I believe some of the information that's out there that says, COVID is really not the problem that we think it is. Well, if it is, it's a worldwide conspiracy, because certainly there have been 217 million cases worldwide and over 4.5 million deaths. So it is a problem. So the disease is real, and it's going to create some issues for us going forward. And as we're seeing with the Delta variant, more and more of us are getting exposed to this virus, so it's going to impact ourselves, our family, and unfortunately now we're seeing it affect our children more. More and more children are getting affected by the virus. And now with the opening of schools, and unfortunately, with the high incidence that we're seeing now with the COVID cases in the schools, and also with the people having to be sent home in quarantine, we're seeing the effects in that school. And at what point is it going to affect the ability to have face-to-face instruction? One thing that we have been proven for our unvaccinated students is the use of masks definitely needs to be done in order to actually help curb that particular problem, since they don't have the opportunity to get vaccinated. Hopefully that will come later in the year, but it won't be probably in time to rescue the early part of this school year. We don't need to be complacent. This virus is real and affecting us. Unfortunately, in the United States, we don't see it as a problem. We have access to this vaccine, but we don't want to use it. Most of the world doesn't have access, and they're crying for it. So we need to actually reassess where we are in utilizing this vaccine. People have concerns about vaccine development. It was too fast. The name Operation Warp Speed did not really engender, confidence in thinking they weren't going to cut corners. Maybe they should have called it Operation Due Diligence or something. But I want to assure people that there were no corners cut in this vaccine development. People said, well, the mRNA technology is too new. Well, actually, it's been used for over 10 or 15 years. It's been in research. It's actually being studied for cancer vaccines. It's being studied actually maybe even using it for influenza. So I think we have to be cautious when we say that it's not a new technology. The information is definitely out there that it's been used for a long period of time. What was helpful in the development of the vaccines is that there was a large amount of resources that were put into it. The government put millions or billions of dollars into research, whereas one particular company could not have done that. That was where the vaccines came from originally. A company decided we needed a vaccine and they ended up going ahead and developing it. Well, one particular company just didn't have the resources for doing it very quickly. But when you had all of this added together and the need was great, a lot of partners got together and were able to actually speed the development of the vaccine. A lot of the steps in the manufacture and the development of the vaccine happened simultaneously, not sequentially. So that was another thing that was able to happen. They were able to actually have the manufacturing processes go ahead and start up at the time that they were developing the vaccine, which a company just wouldn't do before. You had to make sure that you had a vaccine that was worked and effective before you wanted to set in place the manufacturing processes. That wasn't done with this particular vaccine. So things actually kind of all coalesced together to be able to really speed the development of the vaccine. And if you look at the number of doses that have been given and the relative safety associated with that, it is remarkable. Yes, there have been some side effects, as there is with any vaccine. There are local side effects. You put something in you get injected, you do get a little redness and you do get some soreness. There have been some serious side effects, but they are very rare. The myocarditis that associates with the mRNA vaccine causes people a lot of concern in young adults. But that is usually self-limited. Very few of those patients actually ended up requiring any kind of care. And they actually resolve spontaneously. And in fact, I think, unfortunately today, for the first time, I think there has been a death associated with myocarditis in New Zealand, associated with the mRNA vaccine, but that's the only one that has been reported in all the thousands of cases of the myocarditis that have been reported. This process has been very transparent too. Anytime there has been an issue with the vaccine, it has been paused, it has been studied, it has been looked at. If it was something that was going to be hidden, we would not have gotten that. So I think we have a good reliability in the transparency of this process, that if something's going on with all the media attention with the vaccines, we definitely would have heard about it. It's not something that could be hidden. So we also have the VAERS database, which where anybody reports a serious side effect associated with the vaccine. But we have to be careful with this database because anybody can report a side effect, and just because somebody's had a vaccine doesn't necessarily mean it's causally related. And in fact, if you had a motor vehicle accident and died as a result of that accident but had the vaccine, that's reported. So each of those cases are individually studied by the CDC, and so far they have been very comfortable with the amount of adverse reactions that have been reported. So it's not out of line with all of the other vaccines that we have. Some people have expressed their preference that they just would rather have it be natural immunity. I don't want to have a vaccine. I don't want to put something in my body that's going to do this. Well, that will happen, because as the Delta virus has been shown itself to be very infectious, we're all going to get exposed to that Delta virus, and we're going to get, have the result of that. So if you have the vaccine on board, you may be able to suffer those side effects of the virus much better than if you had to rely on your natural immune system. When you talk about this mythical herd immunity that we're hopefully trying to get to, we had to rely on natural immunity. It would take a very long period of time to get there, and it would come at a significant, considerable cost in healthcare resources, long-term complications, deaths. Vaccination can mitigate that. The other thing too is that with the new Delta variant being so infectious, whereas the previously discussed level of herd immunity at 70% was thought to be attainable, now the herd immunity is felt to be more like at 90% because of the infectiousness of the Delta variant. And we feel that that may not be attainable, which means that this virus is going to become endemic and not be something that we're going to have it go totally away. But it eventually will morph into a more benign disease. The other reason people don't want to get the vaccination is personal autonomy, personal freedom. I don't want anybody telling me what to do. Well, we as Americans place a large value on that. That is part of our national identity. But we do accept other limitations on our personal freedom for the good of society. Traffic laws, for instance. It would be very difficult to drive down the street if people didn't obey stop signs. Of course, nowadays it doesn't seem like they do that anyway, but we have to be careful. So at what point are we willing to accept things for the good of society that will limit our personal freedom? That's something that each of us have to look internally about. You know, what am I gonna, if you're not gonna do it for yourself, will you do it for your children? Will you do it for your grandchildren? Will you do it for the good of your community? Mandates are something you're seeing around, not something that we've looked at in Iredell County right now, but at the same time, you know, those are things that are being studied. They're not without their problems, but that's not really something we want to get into at this particular time. But you know, that's something that you can see that is growing across the country. Some people have said, well, there's unknown future effects. We don't know what's going to happen long term with the vaccination. And that's true. We haven't been studied that long, but for right now, with close to 400 million doses, like Joe said, this is the largest clinical trial of any particular vaccine that we've had to date. But at the same time, we've not seen anything. We don't see ICUs full of vaccinated patients that are having a problem. Most providers really haven't even taken care of a hospitalized patient for a vaccinated complication. But yet our ICUs are full of unvaccinated COVID patients. Some people have had some issues with worrying about fertility and infertility. To date, personal, the people who have actually been vaccinated personally and been pregnant, there have been no significant increases above the norm of complications with miscarriage or stillbirths. But what we do know is that pregnancy is a significant risk factor for the COVID virus. It does attack our pregnant patients much worse than if they were not pregnant. So there are lots of different reasons for why people don't get vaccinated. But at the same time, measures have not been really helpful in overcoming that. We've tried to give people gift cards, we've tried lotteries, things like that, and nothing really kind of helps. I think people basically need good trusted sources of information to be able with which to make their decisions. So I encourage you to talk to your physicians, the primary care providers, utilize them as a good source of information. Your healthcare systems, they have a vested interest in keeping you healthy. Certainly, hopefully you will be able to entertain some questions, more specific questions at the end of the discussion. Thanks very much.
Thank you, Dr. Matters. We really appreciate what you've just told us. And now we are going to turn it over to Megan Redford with the Iredell County Health Department to learn more about what the health department is helping us through.
Thank you. And can you guys hear me okay? I had to call in because our we're having trouble with our computers over here.
Yeah, I
and
don't
you
know if can you shut the blind behind you? It's a little,
No, but I can turn my computer. Just hold one minute.
okay.
All right. Is that any better?
Much better.
Okay. All right, and I'm going to share my screen really quick. Today I'm going to share a little about vaccine and testing. Can you guys see that? Okay. All right, so let's get back all the way to the beginning. So, like she said, I'm Megan Redford, and I do the public information for the health department. Vaccine and testing has been something that we kind of, from the beginning, done. We brought in the pandemic with testing everyone, and hopefully we're finishing out with the vaccine. But I'll kind of start with the testing piece of it. In the very beginning of all this, we had to wait on the PCR for everyone, places to get it. We were kind of one of the first to be authorized to offer the PCR testing. So we offered drive-through testing at various locations. And then as we progressed, local pharmacies, grocery stores, kind of other places were able to offer testing, just like it's worked for vaccinations. So we have stepped away as far as our staff offering the testing, but we have partnered with StarMed to offer community testing, because being a local health department, our biggest role is making sure underserved populations are offered services that are available to everyone else. So when thinking about testing and vaccination, we have to think about accessibility, cost, things like that. So we do partner with StarMed, and we offer COVID-19 testing 4 days per week. We used to be able to offer it 6 days per week. Then, we kind of hit a little bit of a lull in the pandemic, and we were getting maybe 3 to 4 people getting tested a day. So, we cut back our contract with StarMed, and we're offering more vaccination. Well, now, of course, the unpredictability of COVID, we are back in a position where 6 days a week testing is actually needed, but we're not able to offer it. So right now, for the month of September, it is going to be offered 4 days a week. However, we're working on increasing that to offer testing 6 days a week. Results from StarMed are guaranteed within about 48 to 72 hours. However, this week we are seeing that the results are getting a little slower because we're having substantially more people get tested. We had 200 people get tested on Saturday at our StarMed clinic, and that was more than we had during the whole month of July. So we've seen a huge increase in testing, and that is not just our agency, that is everyone that you talk to in the COVID world. Individuals can just walk up to our StarMed site, their drive-through, but you can walk up or just drive through with no appointment, but you also can pre-register, which does save you a little time. So we do try to accommodate both sides of the spectrum there. It is, you do have to have a smartphone to register. However, the individuals from StarMed have smartphones there, so if someone shows up and does not have a phone, they can register them, which is a really great feature. Additional testing options are the community. There we go. So the community testing sites, which is part of the NCDHHS COVID response, and the website I put at the top here, and I can share these slides with you later, but they offer 5 options for getting tested. The first one is your no-cost community testing. That will actually take you back to us. That is what we are. We are a no-cost community testing, our StarMed site. So statewide, everyone has what is similar to our StarMed site. The additional option that I wanted to share with you guys is the number 2, the test site finder. That's a really, really great feature. It is real time, so it's updated almost daily with who is offering testing, what appointments they have available, and it will link you directly to their site. That we've been sharing a lot with individuals calling us because our StarMed sites are only 4 days a week, especially with school starting back, more people doing extracurricular activities. We've seen a huge increase in testing. So that is something we share with most people. Another option is the no-cost COVID home testing kit. We still recommend that you follow up with a PCR test after one of these types of tests, just because the reliability can be a little not as reliable as a PCR test, but those are options, take-home tests. And then, of course, contact your primary care provider. That is an option for testing. However, it's not the most feasible, especially if you're on a time crunch, need to get tested before you go back to school, things like that. So those are the options now for testing. So as more testing becomes available locally, we always share it on our community testing site that's on our website. There is, like I said earlier, with the increase in testing, it's making wait times longer. We were seeing results come back over the summer, even within 24 hours for a PCR test. Now we are seeing it closer to the 72-hour mark. So especially individuals getting it for travel reasons, things like that, we encourage you to set up an appointment as soon as you can, because our drive-through clinics are very busy. On Saturday, we were only there for 4 hours and we tested 200 individuals. And these are for PCR. We do offer the rapid testing, but there would be a cost with the rapid testing. The PCR is your most reliable test that we encourage. But through a partnership with the health department and NCDHHS, we have been able to partner with schools. So the schools can actually offer testing at their location, which should start this week. So we're hoping that will ease up the burden on our community testing sites. A lot of individuals here in the last 2 weeks have been students and or teachers getting tested. So we're hoping by the schools offering it for students, staff, and then close contacts, that will ease up the community testing side. For vaccination, we do offer the COVID-19 vaccine at our location, which is a Statesville location, for first dose, second dose, and booster dose. After September 20th, we will offer those booster doses to individuals 65 and older. You do have to have an appointment for that. And that is one of those things in the beginning of this, we held mass community drive-through clinics. We are not doing that now. However, that's not off of our table. If at any point we see that the need for booster doses is more than we can have in our clinic, we are ready to get back out there in the field and do these drive-through clinics. It's kind of just a waiting game right now just to see what capacity we can handle in our facility. And I'm sure it's the same with the hospital because we've been in communicate with them. It's really just a waiting game at this point, what the need is going to look like, but we are ready at any point. Additionally to our clinic, you can access other vaccine sites through vaccines.gov. This takes you to a database that's actually linked to every state's version of CVMS, which is our vaccine system. That takes into account on the back end, did your agency get doses? How many doses do you have left? What brand of vaccine? And puts this in a database so that it's accessible to the community so they can see, oh, okay, the health department is offering the Pfizer vaccine, or Ingalls is offering the Johnson & Johnson vaccine. That way, if people have a preference, they're able to go on there and see what type of vaccine they would like and go make an appointment there. It's really an awesome database that we've been sharing a lot, and it's nationwide too, which has been great for us because we have a lot of people call and say, for example, we had someone call this morning, my daughter is in college in Virginia. I need to get her an appointment for her second dose for Moderna. Can you help me with that? Well, with this database, we can. You can see what brand and things like that. And it takes into account the inventory that you have, which is really great. Another thing we're really excited about in regards to vaccine is our community health worker program. With additional COVID funding, we've been able to hire 2 community health workers, and these individuals can go out into the community, offer COVID-19 vaccine information and education. They are very trained to talk about hesitancies and address common questions that people have, and they're honestly just very, very educated, very smart, but very comforting individuals. They don't make anyone feel like their questions are dumb or anything like that. They are perfect for their jobs, but we have them go out and they're able to go to churches, businesses, community organizations, and provide this one-on-one education that we have found is very good when you can sit with someone and truly address their concerns on a level that they understand and make them feel comfortable. We've seen bigger increases in those individuals getting vaccinated. So we have been able to host mini vaccine clinics after our educational presentations with an increase in people being vaccinated. So we're very excited about this program. And if you want to share this information with anyone, we have no limits on where we'll go, what we'll do. We like to keep our mini clinics to 100 or less people, but we have gone to businesses and vaccinated as few as 6 people. And while that doesn't seem like a lot, that's still 6 people who were hesitant that got the vaccine. And we're at a point now where we're willing to put in the work for just those 6 people. So these community health workers and the community health worker program in general has been amazing. And so if you have any ideas or want to refer this to anyone, I've included the contact information for our community health worker coordinator. Her name is Sierra Ashworth. And there's also no limits. We offer these COVID-19 vaccine clinics morning, night, weekends, because when you're talking a faith-based community, they're not really going to come business hours 8 to 5. You're going to need to go to them when they're having service, so you can be there after service. So we're very accommodating to those needs, and we just want to make sure the community knows that we're here. We want to help. We want to offer this vaccine because it is life-saving. That's kind of all I have as far as vaccine and testing. We are hoping to increase our testing capacity, but like every other industry, it is so difficult as far as, you know, the capacity of our staff has not met the need of the community yet. So that is an ongoing thing that we're working on. But if you have any questions or want to reach out to us, we're happy to help.
Very good. Thank you, Megan. I do appreciate you sharing with us. That was important information. And these slides will be available, and this will be recording on the Chamber's website. So if anyone needs to get that information, that's where you can go to, the Statesville Chamber's website. Next will be our speaker. It will be from Davis Regional Medical Center, and we will hear from Dr. Franklin, who is an emergency medicine doctor. I'll turn it over to you.
Sorry about that. Good afternoon, everybody. Sorry, I'm not at a point where I'm able to join you by video, but is everybody able to hear me well? Perfect. Well, so what I think I bring to the discussion in distinction to some of my colleagues who did a great job sort of giving an overview of kind of where we've been and where we are currently, I am literally the person that you would see face to face if you came into the emergency department. And in fact, some of the numbers that I'm going to give you are so hot off the press that they are from this weekend, as I just did a full complement of shifts. So some of the data that I'm going to give you right now is from, it would have started at midnight on Friday morning and run until midnight Sunday morning. So this is super, super hot off of the press. So at Davis Regional, we saw around 350 patients this weekend, and around 68 to 71% of those patients were patients where we needed to at least consider whether COVID-19 could have been involved, right? To sort of echo some of the things my colleagues had previously said, you know, one of the issues with this virus is its varied and widespread presentation, such that we need to, you know, consider its involvement either as a primary issue or even a secondary issue, as I'm sure everybody can echo that they have had patients be admitted and for totally unrelated reasons to COVID, and then all of a sudden you find out, well, they've actually, you know, test positive for COVID as well. So over the weekend, we saw 350 patients roughly, and we tested 308 of them for COVID-19. 44 of those patients were positive. So that is a 14% positivity rate, which echoes sort of exactly where we are standing with the state. So the state over the course of the last week was a 13% positivity. So we have seen just, you know, significant increases in the number of people presenting with COVID-like symptoms or even sort of COVID-adjacent symptoms. And to sort of put that into the greater context of where we are, not just as a local facility, but, you know, within sort of the greater region, we currently have at Davis, we have 13 patients admitted with COVID. We do have only 3 of those patients having actually been vaccinated. So we are seeing, we can sort of mirror the numbers that other people are discussing, where truly being vaccinated is the sort of primary step that you can take to, limit morbidity and mortality, basically, your risk of having a significant illness or even potentially, dying from the disease itself. So to sort of put ourselves in the greater context, if you compare to, some of the larger facilities, particularly in Mecklenburg County, some of their more recent data would suggest that, they have nearly 550 patients admitted. Over 120 of them are in the ICU, and nearly 80 of those patients are on a ventilator. So this is a serious problem that we are dealing with, not just at our local facilities, but within the greater context of the region itself. And there's a reason that I specifically bring up some of those issues that wouldn't necessarily be readily apparent to someone who isn't familiar with, the logistics of an emergency department or a hospital in general. So if we take just this past week, at one point at Davis Regional, we had 25% of our emergency department that was dedicated to patients that are in what we call a hold status, right? And what that means is that those patients need to be admitted to the hospital. The trouble is that our hospital is full and we do not have a bed for them to be admitted to. When I bring up the data from the other facilities, they are experiencing such significant volume in terms of their inpatient status that they do not have beds available for me to transfer those patients to. So what that results in is a sort of one problem results in having several problems stacked on top of one another. So not only do we have patients who are sitting in the emergency department awaiting to go to a bed, they are occupying a portion of the emergency department itself, meaning that patients who are coming to the emergency department, whether it be for COVID-19 concerns or anything or any other concern, are at a disadvantage in the sense that some of our facilities, our resources, and our staff are not able to be dedicated to their particular complaint or seeing them potentially in a timely manner. So there are concerns beyond just, what is your hospital capacity looking like? What does your emergency department look like? Not just in terms of patients who have COVID-19, but, and this is, I think, the crucial point for some of our local citizens who may be vaccine hesitant, is that this problem does not just affect people with COVID-19. Whether you are a person presenting for a stroke or a heart attack or trauma or any other of a number of complaints that might land you in the emergency department, you could potentially be A, waiting for a bed to be admitted, or B, and I have literally run into this scenario in the last week, where we attempt to, get you to, sort of like a higher level of care, like a Atrium facility or a Baptist Medical Center type facility, and they are not capable of accepting that patient. So we have somebody who is waiting in the emergency department that needs a higher level of care, that is unable to get that higher level of care in a timely manner. And some of these logistical considerations are not something that you would, readily read about or hear on, sort of the daily news, but these are the things that could potentially affect you, your family, and your loved ones if you were to present to an emergency department in your community, because I know Davis Regional for sure, Lake Norman certainly, and I have every suspicion that Iredell Health as well have all been in this exact scenario over the course of the last week. And as Dr. Mazzola indicated, we're still on the upslope of the curve. So that 25% number, where I'm saying that I've got 25% of our emergency department's capacity being unable to be dedicated to people who are essentially, new arrivals, there is a significant concern that those resources could be strained even further. The one other sort of piece that I would like to present, and I will grant you that this is more of an anecdotal experience, but I'm quite confident that the numbers are going to bear this out, because like I said, this is a hot off the press scenario, is that we are seeing significant increases in the number of children who are testing positive for COVID-19. Just in the last week or several weeks itself, I've, had children as young as several weeks old test positive for COVID-19. And this is in comparison to, earlier 2021, late 2020 data, where it seemed to sort of concentrate more in like an elderly population. The significant issue with having this virus be spread amongst children in particular is that currently there are no treatments or approved vaccines, even under an emergency use authorization status for children. And so to sort of echo what everybody has been talking about with, being, very promoting vaccination significantly, is because we are, as a society, going to run into an issue where children could potentially be a reservoir for this virus and significantly limit our ability to conduct business as we would want to, particularly with, in-person education, and then all of the downstream effects that the logistical issues that provides. So to give one example from the last week, we had a local, I believe it was a cheerleading team, have one person test positive, and then that really, puts those coaches and teachers and staff in a quandary, essentially, because, well, what do you do now? Do you send them all to get tested? Where do they get tested? Some of them have been vaccinated, some of them have not. And, what does that mean for their studies and going back to school and all of these things? So again, let me just echo the trouble that having a pediatric population be a reservoir when you are unable to vaccinate a pediatric population can mean not just for kids, but for the population at large. So one of the other things that I wanted to sort of point out, given that we are on a call with local business leaders, is that vaccination and business sort of go hand in hand, and I can speak to this from sort of this lived personal experience as I meet patients on a day-to-day basis who come to me with a scenario of like, well, I've been exposed and I need to go to work, and work needs me to have some type of documentation, and how do we facilitate that as a community? And a lot of times patients will end up in the emergency department to sort of fill those gaps, because understandably the health department is unable to conduct business 24 hours a day. And, particularly when you're discussing someone's income, they need to, often be able to make decisions, on the fly. And if you can come to the emergency department and get testing that will result in, several hours in comparison to, a day or two, that can significantly affect not just your personal income, but it affects the ability of your employer to conduct business. So a couple other things that I wanted to sort of just bring to the attention that people might not necessarily consider with regard to the emergency department itself and vaccination. One of the questions that I get asked a lot is, why are we not just vaccinating people in the emergency department? You're open 24 hours a day. They're there, right there in front of you. You're actively talking about COVID-19. Why are we not doing this, right then? And I really, really wish that we could. Believe me, I would be the COVID-19 vaccine salesman of the year. But just logistically, where we stand with these mRNA vaccines, it's really not practical to vaccinate one person at a time. So we're sort of limited in our ability to interface on a one-to-one sort of every patient as they come in through the door and offer them a vaccine. So we are relying on not just our partners in the outpatient setting, but business leaders to, sort of enact some of the measures that, were previously discussed, like that story about going and giving the vaccine to 16 people. I was muted, but I promise you I was cheering for that story, because that's a great win and a great example of sort of how a public health interface can really reduce the number of patients coming to the emergency department for just that that type of concern. So the one final piece that I'd like to advocate for, and that some of you as business leaders can certainly speak to as I engage with all of your businesses, is some of the difficulty in sort of maintaining a workforce that is public facing during a pandemic, but then also sort of the mental toll that takes on people who are working, on the front lines. So that's sort of my plug. What I can tell you as someone who has taken care of, hundreds and hundreds of COVID-19 patients at this point, is that it has taken a toll on me personally. It has taken a toll on, every person that is in the hospital, but in the emergency departments and ICUs and on the floors specifically. And that ranges from everybody. That is not just the physicians and the nurses. That is the registration teams and the people that are involved in X-ray and your laboratory people, and just everybody has really been working, extra diligently to, combat this issue. And we, like every other sector, are experiencing difficulties in, maintaining sort of an adequate workforce to meet some of the challenges, particularly as they relate to surges and increases in, sort of the slope of the curve of infected people. So as a person who's, a partner in a local business, as well as somebody that is, working on the very front lines of the COVID-19 pandemic, I just urge business leaders to encourage people to become vaccinated, as it will help not just your ability to staff and run your businesses, but it will help our ability in the emergency department to deal with the effects of COVID-19, as we sort of struggle with a higher patient volume and decreasing capacity to manage large volumes of patients all at one time. So at that point, I will turn it back over, and I'm happy to answer any questions.
Thank you, Dr. Franklin. We really appreciate it. We are running a little bit short on time. I'm going to turn it over to Shannon Vieira, our president of the Statesville Chamber, and see if there's some questions that have come in.
Yes, we definitely want questions from those that are attending the Zoom right now. We did have Facebook Live running, and we had a few questions there, and I was going to go ahead and start with those. One is, are there folks who should not get the vaccine? Are there folks that should not get it? That's for anybody.
So, it's Dr. Mazzola. I'll start. I'm sure Dr. Franklin or Ms. Redford or Dr. Metters could chime in. Obviously, anybody who has had a severe clinical reaction to the first dose of the vaccine should talk to their physician prior to getting a second dose. And if you have a known allergy to any component of the vaccine, but in reality, when you look at the recommendations for the vaccine, there are very, very, very limited reasons to not get this vaccine. As we've talked about on the call, we've got experience with over 400 million doses in the US and over 1.3 billion, that's billion with a B, doses worldwide. And there has not been a change in really the indications or contraindications, i.e. who should or should not get this vaccine, short of a known severe reaction and a known allergy to a component.
Does anyone on the call right now have a question for Dr. Mazzola, Metters, Dr. Franklin, or for Megan? While you're thinking, I have another question. This kind of goes back to Megan. Megan, you said schools will start offering testing. Do you know what schools that will be? Is it all schools, or is it just high schools?
So we do know that for our adult stateful schools, it'll be all the schools. However, you have to be identified by the school nurse as either an exposed student, exposed teacher. You have to have that relationship with the school nurse. You really have to be identified for the testing, but the goal is that it would eliminate those people from going to one of our community testing sites. So it's not really public testing, but it should help the public testing site.
So, so the school, so a student comes in or a teacher feeling some symptoms, they'll go straight to the school nurse and then they'll identify if they need that test right there. Okay, that's great. That's wonderful.
Yeah, it's an awesome program they've got.
And then I'm assuming that they won't get rapid results. It'll be is it the PCR testing they're doing, or?
They actually in the school setting are doing rapid testing.
Okay, very good.
It's not, as far as diagnostically, we really still encourage that PCR, but for the prevention standpoint, the rapid is the best case scenario for that because it eliminates that instant exposure. So rapid will be used in the schools.
And I had another question for myself is when they're doing, when they're doing these tests for COVID, is there a differential? Does the variant look different than the original? Does it matter, or do we just automatically assume it's the Delta variant?
Right now, it's an automatic assumption that it's the Delta variant. Last Friday, we get our updates on Fridays, and the update we got from NCDHHS was 98% of the tests that were sequenced are the Delta variant. And how that works is testing samples are sent to the state level, and the state level does genome sequencing to determine what variant it is. And so for our area right now, it's about a 98% that it's Delta.
Does anyone else on the call have questions specific? John, okay, I've got a question. How do we estimate the trajectory of this disease variant or others affecting businesses as we go into flu season? Good question. Anyone want to take that?
So, Dr. Mazzola, again, I don't mean to jump in. Certainly my colleagues are well-versed as well. You know, there are multiple models, just as the weather forecasters try to predict the trajectory of a hurricane. There are multiple models that come out of our state. I think North Carolina historically looked at UNC modeling and Wake Forest. You know, what we're seeing is that we are probably still 2 to 3 weeks away from a peak in North Carolina. And I'll defer to Dr. Franklin or Megan or Dr. Metters if they've heard anything different. But the modeling that we're looking at Iredale is essentially talking about 2 to 3 weeks away.
I think what we've seen is actually in situations where vaccination rates have been high. So like Forsyth County, they're starting to see a reduction in their cases, but their vaccination rate is much higher than our county. So I think the counties that actually have high vaccination rates are starting to see maybe that they peak or maybe start to go down. You know, models are, like Dr. Mazzola says, they're kind of from the weather forecasting, uniformly all models are wrong. We just hope that some of them are helpful.
What about recommending, should businesses consider their social distancing methods, which we already know what those are? Do they need to increase those or continue with those? What about reducing hours? Any recommendations along those lines?
I think certainly,
Personally, sorry, go ahead.
Go ahead, Dr. Franklin.
Well, so personally, I would recommend sort of the more masking indoors, the better, given our vaccination rate. But in terms of managing a business itself, I'm going to present some anecdotal evidence currently, but I believe that this is going to bear out. In my personal practice, I have found that the Delta variant has a better positivity rate to antigen testing, meaning the rapid tests. I suspect that is due to the higher level of viral particles that are present in the nasal passage with the Delta variant. And the reason I bring that up is because there are some over-the-counter testing kits which you can have as a business owner, which are not terribly expensive. Last time I was in, I think, Walgreens, you could pick up a couple of them for $25 roughly. And, you know, that having that type of rapid access to relatively accurate testing can certainly help you on the fly make some business decisions that may allow you to, you know, avoid an outbreak among your staff in particular.
But also, I think what we're seeing is that most businesses are having good practices. Where the exposures are occurring are not in a business setting, but are in a off business or leisure time setting, where people don't mask, they get into indoor events with other unvaccinated individuals, and then they get exposed that way. I mean, that's the biggest thing that we've seen, because if you look at the experience of the schools last year, there was very little in-school transmission, and most of the transmission is occurring out of school once they come home, and then bringing it back to the school.
Yeah, I would echo that. I'm sure, you know, Dr. Franklin is seeing it at Davis and his colleagues at Lake Norman. We are seeing clusters within families. You know, we at Iredell, I've lost count of the number of husbands and wives or parents and children, adult children. We don't admit young children here, which is a whole another scary scenario that Dr. Franklin points out. You know, the diligence in the community for social distancing, masking, it's almost a double standard. You walk into a healthcare facility and everybody's masking, they're wearing N95 particulate matters masks. And then, you know, I leave my safe confines of my building and I walk out, and it's almost like the Wild West. So if I have any parting comments, my plea is, you know, wear a mask, social distance, wash your hand. Wear a mask, social distance, wash your hands. Dr. Franklin points out the trajectory, and I think we're all seeing it. It's coming at us fast and furious. And I think as business leaders, as he pointed out, I also own a business in Orlando that I have shut down at the current time because of the virus. You know, we can be leaders and do the right thing. I think the point of care testing that Dr. Franklin talked about is a fabulous idea. You know, encourage your customers and the people that and your clients you deal with to wear masks when they come into your business establishments. I wear a mask all the time. It's not fun. We're 20 months into this or more. We're getting fatigued, but I feel also just the worker fatigue. We are seeing healthcare workers leave healthcare by the drones. Nurses are giving up. Doctors are giving up. They're tired. Dr. Franklin shared his personal experience being on the front line. It is very emotionally and physically draining to do this and to keep doing it. This is not a one and done, very short, emergency that we're getting through.
I have another question. On the vaccinations, what's the best way for people to get educated on what's in the vaccines? What would you recommend?
You could go to the CDC website and just go, and go to the vaccine, and it lists out all of the ingredients in the vaccine of all of the vaccines that are currently available. Of course, there's only one FDA approved. That's the Pfizer vaccine. The other two are still issued under the emergency use authorization.
Are there any other questions from you all here on the Zoom?
One more thing, back to the educating about what's in it. The CDC has a lot of awesome graphics in their communication section that actually show you kind of what's in the vaccine and how the vaccine works from a non-clinical. I mean, I do public information. It helped me understand how the vaccine worked and the you hear the buzzwords like spike protein and things like that, but the average person doesn't know. So those graphics are awesome. We share some of them on our Facebook, but the CDC Facebook page and then the CDC on their website, the communications tab, awesome graphics that kind of very, very plain language explain how the vaccine works and what's in it.
Thank you. I don't see any more questions. Again, thank you, Dr. Mazzola, Dr. Metters, Dr. Franklin, Megan. We appreciate y'all taking time out of what we know is a very busy time for all of you. And as information changes, just feel free to reach out to me so I can share it with our business community. Again, thank you so much, and thanks those for joining us live on Facebook and our Zoom here today.
Thank you for having us.
Thank you, everybody. Have a great day.
Thanks. Have a great day.